afternoon and welcome to our webinar or our session today on our really exciting new partnership with PREKURE around the IPMHA Health Coach training, which we're really pleased to be able to bring to you in 2026 and 27. I'm going to kick us open with a karakia and then we'll do a round of introductions before getting into the presentation. We do have the Q&A function open today, so we'd really appreciate all of your questions because we are new. This is a new kaupapa, a new program, and I'm sure you've all got lots of questions for us. So as we go through, feel free to use that function. Opening us up with karakia. Kia kotahi i ngā pukenga me ngā whakaro hei tiaki i ngā whānau mana mahi haura, me mahi tahi tātou mā te katoa haumi e hui e tae ki e. It's a pleasure to be with you this afternoon. I'm Jess Morgan-French. I'm the CE at Collaborative Aotearoa. I was a health coach back in my early days of the primary care health system, and it's really, really exciting and a bit of a passion of mine to be able to bring to you our partnership with PREKURE around training New Zealand health coaches working in the IPMHA health coach program. I will pass you over to Louise, who will introduce herself and her team.
Kia ora katoa, everyone. We are absolutely delighted to be here. My name is Louise Schofield. I'm the CEO and co-founder at PREKURE, where prevention is cure. At PREKURE, what we do is train masterful health coaches, and we're very excited to bring that expertise into the IPMHA program. What we're really good at is training health coaches with a deep health science knowledge, lifestyle medicine on the one hand, and on the other hand, behaviour change and coaching skills for self-empowerment, agency, and long-term behaviour change. At PREKURE, I'm supported by an amazing team. On the call today is PREKURE's General Manager, Yasmin McCarthy, and also I want to introduce you to Kerry Hartley-Jones. Kerry is going to be the learner lead for the IPMHA program, or she's going to be who your health coaches will be getting support from in their learning journey over their 6-month health coach training program.
Kia ora, Louise. And we've also got Renee Ward on the screen, who may be familiar to many of our members across the country. Renee is from Marlborough PHO, who has been seconded into the collaborative to work with us and the team at PREKURE on the health coach program delivery. So all of your questions, partai queries, non-silly questions can all go kind of Renee's way, and she'll help you navigate through this new training process and kaupapa that we're going through. I'll get Renee to put her email in the Q&A and you'll be able to get in touch with her as we go through. We do have a little bit of a presentation that we will walk you through now, and then we'll come to all of your questions. So make sure you're using that Q&A function throughout this next little bit. Over to you, Louise.
So, as Jess has said, this is a collaboration between PREKURE and Collaborative Aotearoa. We are very keen to help your health coaches to be highly proficient with a deep, rigorous training and knowledge, to be culturally responsive, but also integrated into your primary healthcare clinics. So that is what we are all about. And that is what the kaupapa is. We're really looking to build a resilient health coach workforce. It is a unique approach. So PREKURE's strength is in that expertise and knowledge of training health coaches. And of course, Collaborative Aotearoa have experience and deep expertise in integrating all sorts of different models of care into primary care. And so it's a really nice partnership where each organisation's strengths can work together. So far, PREKURE has been in existence since 2018. We have already produced over 850 highly proficient health coaches. We've also upskilled over 2,000 health professionals, including doctors, nurses, and allied health professionals. We have a faculty of over 30 clinicians, coaches, and professors and academics in the health area. We are endorsed for training by the Health Coaches Association of Australia and New Zealand, the International UK Health Coaches Association, as well as endorsed as a training provider for continuing medical education with the New Zealand College of GPs. Other than pure health coach training, we have advanced coaching pathways, including mental health coach, what you would know as health improvement practitioners, metabolic master health coaches. We've worked extensively in the community with Pacifica health coaching programs, particularly with the Whānau and Etu Pacifica. We have used our Whatu Ora Whakaako Māori health coaching program with organisations like Mahitahi Whatu Ora and the Kahununu Executive in Wairoa. And we also have extensive experience upskilling and doing CME and CPD for health professionals. Jess, I'll let you talk a little bit more about Collab.
Yeah, kia ora. So many of you will know Collaborative Aotearoa as being part of our membership or having I guess, attendance into some of the work that we've done over the years. For those that don't know, Collaborative Aotearoa is a membership organisation servicing both PHOs, community organisations and practices directly. Our kaupapa really is to foster health and hauora equity for all people within New Zealand, and we do that by modernising and evolving models of care across the primary and community care sector setting. One of the ways that we have done this is around extending the primary care team or the people working specifically within general practice. So we've seen practices evolve over the last 10 years and bringing a whole lot of different professions into their workplaces. Health coaches being one of those through the IPMHA program and also the HIPS as well. So we're really passionate about making sure extended care teams are adding the value they should be adding into a primary care team, but also adding that diversity in terms of service offering across the system. We have a really deep knowledge around how primary care and general practice work, and we exercise that across the work that we deliver to the sector. We are an education provider, so we offer lots of education to our members and to people in the system. And this is just another really good partnership around us linking in with another education provider who's really passionate about similar values, especially when it comes to quality of training. So we're really excited about working with PREKURE on this and supporting the kaupapa as we go through. Because we're so knowledgeable and connected into the primary care sector, one of the key strengths that Collab brings to this partnership is around the so what does that mean in practice, and how do we ensure that the training provision that PREKURE put out is culturally responsive, it is including long-term condition management and all of the other elements that are really specific and focused in on general practice. So we will be working with the team at PREKURE to make sure those elements are really embedded into the training program and are really supported as we go through. So that will be something I think you can be excited about and can kind of link in. Renee's role is really about ensuring that you, all as IPMHA employers, are able to have your voices heard within our kaupapa and program as well. This isn't just PREKURE and Collab's thoughts and thinking. This is about bringing the entire network of IPMHA employers together to ensure that we really hone in and provide a product and a service and a training program that's really welcomed and required, needed by the sector. So we will also have a governance group that kind of links in over top of there. But excited to be here, and I'll hand to you to talk about the regional leads.
So we have PREKURE has a learning hub, so there will be a consistency of the training that is delivered, the key competencies. But we will also have 12 regional leads. that across the motu that will come in clinic and provide in-person, in-clinic mentoring of your health coaches, your trainees, as well as in-person assessment. So we're very excited to be able to do that. And it will also mean that with some regional differences, we'll be able to incorporate that into some of the learning and the training. Jess, is there anything else you'd like to say about that, or I'll keep going?
I just think the regional leads aren't currently in place. I'm sure many of you can empathise that we are week 3 going into week 4 of running our program, with some of those being public holidays and weeks off. So we are hitting the ground quite hard and heavy in 2026, but recruiting our regional leads is one of Renee's top priorities over the next 2 weeks. So expect an expression of interest to come out to you next week around regional leads. And if you do have health coaches that you think would be really good at this, we would love to hear from them as we open up this expression of interest and go through that provider process. And just a bit of reassurance that the regional leads will be in place by the time cohort 1 trainees or health coaches require the mentoring and in-practice assessment.
Right. So this training program is 6 months. So we listen to sector feedback and have heard that the health coaches need to be trained rigorously, but they also need ongoing support for a minimum period of at least 6 months. And so the training program has been designed with that in mind. I also want to point out that you can enroll, and your health coaches, your new health coaches, can get started on the PREKURE Collab training on day 1 of their employment. So you do not have to wait for a cohort to be starting. I will be talking to you about when those particular cohorts do start. There is one coming up starting on Tuesday, February the 17th. It is over half full. So if you're thinking about that one, you need to be in contact with us soon, but we'll let you know how you can do that. But just to reiterate, it's a 6-month training program. Your new health coaches can get started on the first day of their employment. We have an online learning they can complete, but they can also access live health coach practice training with our very experienced faculty, and lifestyle medicine training and knowledge, and asking questions, live sessions from week 1 of their employment with you. So we've really done that so that there's not a delay, that you're not having to wait for another cohort to get started, and that your health coaches can get the support and start their learning immediately that they start employment with you. So as an overview, and this is quite a lot to take in, but we will be showing you a web page where you can download a prospectus and have a look at all of this information again. But this will give you a little bit of an overview of the learning journey that your new health coaches will take. So day 1 of employment, they can, if they're enrolled with us, receive an onboarding call, and so to understand, get them enrolled in the online courses, start their learning and understand how it works. Now that will happen live with Kerry Hartley-Jones, who I introduced earlier on. In that first week, they will complete their first online course called Behaviour as Medicine. I'll go into a little bit more detail of what is covered there in a moment, but it does cover things like scope of practice, cultural safety, and all of those things that are really important that your health coach needs to know right from the beginning of their employment. So they will do that online learning, and then they will also be able to attend a coaching practice session, and as well as an Ask the Expert lifestyle medicine knowledge live training session from that week 1. They will then be put into a cohort. The first cohort begins on February the 17th, and it's a 2-day intensive health coaching skills workshop. It's delivered online. It's 2 days, on Tuesday the 17th of February and Wednesday the 18th of February. And that's where we really teach the health coach all of the foundational skills that they need to know. Following that, they'll attend a 2.5-hour coaching skills workshop. So 6 of those over the course of the next 12 weeks, one every fortnight. In conjunction with that, every week for the entire 6 months, they can attend a coaching practice session. They have to attend a minimum of 8 of those over the 6-month period. But if time allows, they can attend a live one every single week for their 6-month training. Also, they'll have the Lifestyle Medicine Ask the Expert sessions. This is where we focus on health science and lifestyle medicine that is most likely to come up with patients and whānau in primary care. They will have 5 self-directed online courses to complete over the 6-month period as well. Once they've finished their 2-day intensive and their 6 2.5-hour coaching foundational skills workshops, they will begin their online mentoring. So again, every week they'll be able to attend, once they've finished their core training, they'll be able to attend ongoing mentoring to really consolidate their skills, get input and feedback from our faculty. Towards the end of their training, they'll start to get more in-clinic mentorship from our regional leads, and they will perform an in-person assessment with one of the regional leads assessing them. I'll talk a little bit more about the level 4 micro-credential, which we currently have in progress that we're hoping most of these learners will be able to complete. This is a very busy slide, so I don't expect you to take it all in. But if you just look down the column, the dark grey column on the left-hand side, you've got an onboarding call that'll happen in the first week of employment. You've got 5 self-paced learning courses that your health coaches will do. You've got a 2-day intensive coaching skills workshop. You've got 6 2.5-hour coaching skills workshops. And then you've got weekly coaching practice sessions where they practice their coaching. They get feedback from our faculty and they really hone their skills. They'll have access to weekly Ask the Expert sessions where they really start to put their lifestyle medicine, health science knowledge into practice and questions. And then once they've completed their 2-day intensive workshop and their coaching skills workshops, they will have access to attend the weekly online mentoring sessions. Then there will be at least 4 hours of one-on-one mentoring in clinic, and then of course their evaluation. So we've tried to make the 6-month program as flexible as possible so that it will fit in with your timetables and schedules for your health coaches in terms of their employment. I've got a little bit more information here about some of the detail, but just remember the 2-day intensive, that's where we really teach the foundational skills for health coaching. There will be a lot of practice and feedback and guided reflection. And then as the health coach starts to take patients and whānau in practice, every 2 weeks for 6 sessions, they will hone those skills and learn some more advanced skills, particularly in the area of mental health and addictions in those 2.5-hour coaching workshops. Now, at this stage, these are delivered live online via Zoom sessions. We'll be, of course, covering all the key competencies that you would expect, including culturally responsive frameworks, whanawhale, talanoa, all of the different Māori health models, mental health and addictions and lifestyle medicine skills, how to coach for behaviour change, a lot of focus on clinical safety and scope, and working with the different members of the primary care team. But we'll also be ensuring that the health coach knows how to keep themselves safe and well in terms of their ethical and professional practice. The online learning is probably one of the areas that really sets PREKURE and Collab's training apart. It is university level. Now, I know that I don't want you to get worried about it being university level, because we train all sorts of people who come to PREKURE who may have had no academic background other than leaving school. So our training is set up to be videos, textbooks, podcasts. It's short, it's easy to consume, and we also have a very strong learner support function, which is what Kerry leads up. And so we're used to helping and supporting learners who come to us with all sorts of different backgrounds in terms of their academic knowledge. So the 5 courses that the learners will go through is behaviour as medicine. As you can see there, we cover positive psychology, the scope of practice, culturally responsive models, and all of the latest behaviour change techniques. Then Kai as medicine, nutrition as medicine, is a really deep knowledge of nutritional science that will support patients and whānau. Exercise as medicine, a lot on mind, body, mental health and addictions. Obviously, that's a special focus. And then the last one is making sure that health coaches do understand common medications, to understand how the healthcare system works, how to navigate and how to integrate the best way within the primary care team. So those are self-paced learning courses. There is some assessment at the end to ensure that the behaviour, that the learning has been taken on board. Now, as well as this training, your learners will receive resources. They receive a textbook around the foundations of health coaching in primary care. They'll have access to an extensive library of health coaching demos across all the major topics that they'll be using on a daily basis in primary care. They also will receive patient and whānau handouts that they'll be able, already done for them, that they'll be able to use. So it's very much, it's rigorous, but it's action orientated. They'll receive the tools, the frameworks and the processes they need to really make a difference as a health coach in primary care. There will be ongoing mentorship and assessment, and this is blended by weekly online mentoring once their formal training's completed, but also that in-clinic support as well. What else have we got here? We will be making sure that the health coaches are safe to practice and are really integrated into your practices. I'd like to just finish by playing a video and then we're going to go to some Q&A. Now, this video was prepared for us by the Pacifica Medical Association, and it just reflects some of the work we've done with them over the past 3 to 4 years.
Ke ola, my name is Tapanga Roti. I am a Whatu Ora navigator at Whatu Pacifica.
Kia ora everybody, my name is Joseph Masiliki and I'm a Whatu Ora navigator at Whatu Pacifica Auckland.
My name is Maria Katoa and I'm a Whatu Ora navigator from the Whana.
I really enjoyed the PREKURE course that helped me deepen my knowledge around health coaching and also mental health.
My overall experience with the PREKURE Advanced Mental Health course was very informative, gained a lot of insight and a lot of tools and knowledge to help assist me in my day-to-day work as a Whatu Ora navigator.
Being able to gain the knowledge and like practical skills, and the practical skills that I gained from PREKURE was being able to engage in creating respectful and healthy relationship with the clients.
In PREKURE, we learned about tools that helped develop Talanoa in a better way. And it has helped me communicate with my Whatu Ora families and also better understand their family stories and situations.
What PREKURE has done for me and throughout my work as a navigator has helped me realize and see that for a lot of our Pacific families, they just need somebody to listen to. And with PREKURE, it teaches you to listen without judgment and listen with curiosity, so that you can ask the important questions that are needed for our clients to find answers for themselves.
It's allowed me to listen and being active listening, and often the clients will come up with the answers to their own problems.
One word that describes PREKURE is knowledge.
If I were to describe PREKURE in one word, I would say open-mindedness.
If I would describe PREKURE, I would say incredibly positive. I would like to say a big malo aupito to the PREKURE team, and congratulations to all the graduates. Malo aupito to our whātua.
Okay, so we will go to Q&A very shortly. Just wanted to reiterate that if you are looking for one of your health coaches to enter the 2-day intensive training that begins on Tuesday, the 16th of February, we are already half filled up with that. So there has been a lot of interest, which is fantastic. We do have a limited size for those 2-day intensive, so we're already half full. If you are looking for how do you sign up, how do you register, we have a website, which I'll just get one of the team to pop into the chat. But we have a website where you can register your interest, and we will be immediately back in touch with you to get your learner enrolled and underway. We have other 2-day intensive at the moment scheduled for May, July and October, but we are working collaboratively with the other provider of the IPMHA health coach training, and so we will just try and coordinate with them. So thank you very much for listening. I know you'll have a lot of questions, and we are now here to answer them.
Kia ora, Louise. And we do. People are putting lots of questions into the chat, so thank you to everyone who's contributed. Just a quick note, putting your questions into the chat, great option. If you hop off the webinar and go, damn it, I should have asked this, remember you can email Renee. Her email is also being put into the Q&A to ask those questions. The first one, Louise, is will the health coach be practice ready after the first week of online training, noticing that the 2-day workshops are scheduled, as you've just said, quite far apart? Specifically in the initial training, will it cover things, health coaching skills such as confidentiality, note-taking, managing disclosures, conducting a health coaching session, promoting the role within the practice, goal setting and similar essentials?
So after week 1 of the online course, at a minimum, behaviour as medicine, and attending 2 of those 1-hour live sessions, they would be appropriate to start with support and supervision. So, you know, they will have done the very first part of the health coach training. So depending on what you've already been doing, so we've set it up so that the answer is yes, but if you're asking if they will be confident, technically really highly trained at that stage, no, they won't be. Are they safe to start with support? We would say yes.
also going to be very coach dependent. Some people are going to come into this training at a different level to others. So it would be up to the employer to also take some lead on the competency of the person after they've done that 1 week and lean into what's required. But our aim is that they absolutely would be able to come into practice and start doing some shadowing, start doing maybe a couple sessions a day with patients and clients, and kind of starting to work up to working fully within scope. And that's how we've designed it, because we listened to you. We asked quite a few employers what were some of the challenges, and the challenges were waiting for those cohorts to start. So we have tried to really listen and respond to that in there as well. Another question, and this is, very linked into, but at what point of the training would a health coach be able to start in the clinic? Specifically, is this after the 2-day intensive? So we have somewhat answered that, but just to be very, very clear, you, as an employer, it's up to you to really ensure that your health coach that is coming in is feeling like they are practice ready, or that they're ready to start absorbing some of that environment. Do you have anything to add on that one, Louise?
Yes. So in an absolutely ideal world, your health coaches would come in, they would do behaviour as medicine online, and they would do their 2-day intensive training within the first week. And then we're 100% they are ready to go. However, that's that ideal situation won't always happen. So as Jess said, we have designed it that, yes, they will be safe to start practicing after they've completed that behaviour as medicine and attended at least, one of those live coaching practice and ask the expert sessions. We wouldn't say they would be a PREKURE qualified health coach by then, because they wouldn't have been assessed in the competencies, and they wouldn't have they wouldn't have all the knowledge and have learned all the skills that we want them to have. So I hope that answers the question.
Great. And it's Seema's question, and she's got her hand up. So we're going to hopefully be able to bring Seema off mic.
Yeah, thanks. Sorry. Just wanted to clarify, when you said they'd be ready to start a practice with support and scaffolding, who would, what's the expectation of who provides that support? Would it be the training institution, or would it be us, or who would that be?
So it'll be you as the employer, just as I would expect that you would have plans to do that with a new employee in their first couple of weeks of. So we understand there will be already onboarding processes that they'll be going through, and there will be support structures set up for them, just as any new employee would be. Would that be right?
Yes, and I think they'd also be able to jump in, like Louise said, to those online live sessions, which actually are designed for answering questions, doing supervision and support as well, Seema. So although they'll be getting kind of employment support from you, and no doubt there'll be somebody in the practice that's also providing a little bit of uppy and support through their kind of first few weeks. They'll also be able to bring any kind of, I guess, health coach specific challenges to those live sessions that are happening weekly. And we've got Kerry as well, who's able to support and uppy anybody if they need support before those sessions are live. So I think a bit of a team effort maybe is the best way to answer that one as we go through. Kerry's asked a question: what are the minimum modules workshop sessions that are needed to be completed prior to starting in the medical centre? So I guess maybe that's asking a little bit more detail. What's in that first, I guess, set of online learning modules that they would be doing?
So at an absolute minimum, they would need to have completed the first online course, which is called Behaviour as Medicine. And that's where we do cover the note-taking, the scope of practice, the cultural safety, all of those things that we need to make sure, the confidentiality, all of those things that we need to make sure that the health coach is safe in the practice, so they must have completed that. We would strongly encourage that they have come to at least one of those coaching practice sessions, and ideally an Ask the Expert Lifestyle Medicine session in that first week. Now, for them to be a fully qualified IPMHA health coach that has completed PREKURE and Collab's training, they must have completed all 5 of their online courses. They must have attended the 2-day intensive. They must have completed their 6 2.5-hour deep dive coaching skills labs. They must have attended a minimum of 8 1-hour coaching practice sessions where they would have got feedback from the faculty. They must have attended at least 12 mentoring supervision sessions over that time period, and they must have passed their in-person coaching assessment. So there is quite a difference from them becoming fully qualified and provisional, ready to start with support from their employer after week 1.
Right, and Kerry has also got her hand up, so hopefully she might be able to just, jump on, Kerry.
Thanks. Thank you for that. Can you just tell me what the time expectation is for those 6 modules within the Behaviour as Medicine online learning package?
Yes, so it will be around, depending on the learner, but we would say in that first week it will be a minimum of 8 hours of learning for them, working through the different videos, all of the information that they would need to get through. And there is a small assessment at the end of that. So they will have to pass with 75% or more, a quiz, a test, and just making sure that that learning has been reinforced. If they don't pass it on the first time, that's okay. They work with Kerry, we support them, and they have another go. In an ideal situation in that first week, they may also, depending on how much time you as the employer can give, they could go straight on and start work on the next course, which is CHI as medicine, nutrition as medicine, if they had more time to do some of that as well.
Nice. So Logan's asked a question, which I'm sure 3 other people have liked, so it might be quite a commonly asked one. Are our current health coaches able to access the online module?
Unfortunately, Te Whatu Ora has that's no at this stage. However, please do be aware we have signalled this to Te Whatu Ora Health New Zealand that we think there will be existing health coaches that could really benefit from some of this learning and knowledge. So we are advocating for that, but at this stage there is no funding for that. So the training is only for new health coaches and explicitly who have not received any IPMHA health coach training previously.
Yes, we hear you, Logan, and watch this space. We are trying our damnedest for you. Another question, which I think, we're diving into the detail, but that's what this is all about because we're all learning something new here, is can we have a bit more of an idea of the content of each session or each kind of module, if you like? So specifically, what's in the mental health and addiction module, nutrition advice? Are they trained to give a prescriptive advice around nutrition, or is it more broad? Working with the primary care team, including the HIP, etc. So, can you dive into a little bit more detail around the content of each of the modules?
Absolutely. So, and do be aware, we do have a prospectus that you can download and we'll give you more information as well. So again, that if you go to the website, you'll be able to download a prospectus and get some more information. But to begin with, it is a health coaching approach. So that means that we meet the person, the whānau, where they are, and we use a coach approach first. So the health coaches are taught to see the person and not the problem. They are taught all of the foundational coaching skills of listening, of powerful questions, of staying on the patient or the whānau's agenda, not our own agenda. So that is really important, because that is what health coaching is. It is about self-empowerment, sovereignty and agency to really make sure we get long-term behaviour change. Now, yes, you are right. The difference with PREKURE and Collab IPMHA health coaches is that we will also teach them a deep technical knowledge around nutrition, as an example, around mental health skills, around exercise. But that knowledge is it's never to be used in a prescriptive way, and it's only ever to be used as an education on the whānau or the client's agenda. So in terms of nutrition, what might be covered in there? It will be really understanding all of the macronutrients and micronutrients that make up a healthy diet. It will be looking at the Health New Zealand food guidelines and talking about, with different chronic conditions, what is best practice, for example, with patients with type 2 diabetes. It will be the latest evidence-based scientific nutritional knowledge, of course, following all of Health New Zealand Te Whatu Ora's guidelines and practices as well. In terms of mental health and addictions, the health coaches will be trained on things such as acceptance and commitment therapy tools. Health coaches are not therapists, but they will have a whole range of tools and skills in their toolbox to use. So acceptance and commitment therapy tools, for example, techniques such as dropping the rope, or understanding towards moves and away moves. So there will be a lot of training around those types of things. The health coaches will be trauma-informed trained. So they will have the manners models and other skills around how to work with someone who has had trauma in their background. So very specific but evidence-based skills and tools will be taught across all of the areas. In terms of in the exercise, they'll be trained on exercise for different populations, different for the frail elderly compared to perhaps a young pregnant mum. So it's that level of technical expertise and knowledge that they'll be trained on. But I do want to be very, very clear, health coaches don't prescribe. They empower people, and they will have the knowledge to educate. They will never go against they will work within the primary care team, particularly with the general practitioner. They'll work closely with the HIP and the nurse practitioner as well.
Beautiful. Thanks, Louise. Hopefully that gave you a nice comprehensive dive into what's on offer and a really exciting package there. Seema, is your question related to what Louise has just been talking about? Yeah, great. Jump off mute.
Yeah, thanks. Sorry about that. Lots to ask. Yeah, thanks for that, Louise. Just with regards to the mental health and addiction kind of module, and I appreciate you want to teach them some ACT skills. I guess what content is there around like understanding, what skill you use with what person? And I mean, that's very much a clinical judgment thing, usually in terms of if someone's experiencing depression, anxiety, something like that. And what training will there be around risk and safety of a particular person's presentation, and whether it's appropriate for a health coach to work with them or to refer to the HIP, and is that part of the training in terms of working as a team member in the IPMHA model? Thanks.
Thanks, Seema. Great question. So yes, we in the module that is mental health and addictions, I think it's the 4th short course, the learners are extensively trained on all of the different mental health conditions, what they are, and also what is clearly in their scope and when and who to refer to. So there is a lot around safety and, what they will, what's appropriate to be working with someone and when and how to refer. So absolutely, that is really covered extensively in the program. We've had someone, a couple of people come to us and say, look, as the employer or the health coach lead, would I be able to come and sit in on a couple of your trainings to get a bit of an understanding of what you're going to be teaching our learners? And the answer to that is absolutely yes. So we realise we're a new provider, and so we understand that you really want to have a look at, what are your health coaches being taught. So we encourage you, if you would like to come as an observer, probably not to the whole thing, because I don't think you'll have enough time, but certainly we would encourage you to come along to that. We're also able to make some of the, if it gives you more confidence, some of those modules, Seema, in particularly in the mental health and addictions, some of the videos and the learning, we're very happy to make those available to you to have a look at.
Nice. And the questions keep coming in. So I know we were going to try and wrap up in 45, but we're going to keep going because your questions are valid and we want to make sure that we get to every single one of them. Kerry has talked about a learner that's a little bit like me, and she said, can the online module sections, e.g. the nutrition / the exercise, etc., be done in parallel, or do you have to do all of the nutrition one before you can move on to exercise?
So what we enforce is you start with behaviour as medicine, because as we've said, we need to make sure you're safe, you've got your scope of practice and all of those things. Then you can actually do any of the others in any order that you want, and you could have a couple going at once. And so remember, the stipulation is that the learners complete those 5 courses within the 6 months at a minimum. So there's quite a bit of flexibility there. We expect that many of them will want to get those done within the first 2 to 3 months, but it is a substantial amount of learning and knowledge in there. Importantly, the learners will also have access to be able to download and to go back into those courses in the future to get the resources, because we know from our other students and learners that sometimes they see a really good resource or they remember something, and then a couple of months down the track they've forgotten it. So they will have access to that.
Great. John's asked the question, which I think we have somewhat covered. So John, do come off mute and camera on if there's a bit more to add in here. But what is the scope expectation of competencies relating to mental health and management of risk? Is there anything else to add to that, Louise, compared to what you've just covered?
The expectation, so I think I may have Kayla on the call. If I have Kayla, who is in our R&D team, so Kayla is one of the amazing PREKURE team members who is behind putting particularly our mental health and addictions tools together. Feel free to come off and jump in here, but certainly at a minimum, the expectation and the criteria are that you can identify when it is appropriate for you to offer skills such as some of the mental health skills that we do, and when it is appropriate that you will need to refer because it is out of your scope of practice. Kayla, I can see that you are there. Do you have anything to add to that, particularly around mental health and addictions, what we teach, but also how we ensure that the health coach themselves or the whānau or patients are not at risk?
Absolutely. Thanks, Louise. As Louise has mentioned, it's very much about assessing risk and understanding if the scope is within what a health coach can work with. And so that's really about putting those behavioural things in place, supporting whānau and patients with tools and strategies that they can really use within sessions and in between sessions. They will be well trained to understand when that goes beyond their scope. So we're really talking about the mild to moderate space, and once things start to escalate, health coaches know how to identify those risks and escalate to other professionals within the mental health and addictions team. We've seen this work really well in conversations with the team at the whānau out in Manirewa. They've got a beautiful model where they have health coaches, HIPs, social workers and psychologists all working together. And so the health coaches sort of work in that space about the behavioural aspects that whānau can put in place. And then when more sort of talk therapy is required, the psychologist comes in and supports in that space.
Kia ora, Kayla. And we've got Jacqueline, I'm assuming your question's related to the mental health kōrero? Yeah, all yours. Come off mute. Is it not letting you come off mute? I'm going to try again now for me.
Kia ora.
Kia ora.
Kia ora. So I'm in Taumaranui Kōkiri Trust, and we've got health coaches and health improvement practitioners already in practice. So I was looking at this as a new, it has to come forward, it's moving forward. My question was, like, health coaches, they're brilliant. It's what we need, and they do the bulk of the work, to be honest, because they go into the community as well as sit in the GP clinics. My question to you is, when they get stuck out there, and I mean, it's more or less what Kayla's just referred to, but I'm wondering, are we providing enough because I'd like to put health coaches into a clinic, and then if they need me, they can call in to say, hey, I've got this dodgy question, and this is what I need your answer to. So moving forward, because we're a low to moderate mental health team and we work alongside psychologists and health practitioners, mental health practitioners in the clinic, it sounds like this is like exciting. But my question really was, when they themselves are unsure about what next to do, and they don't want to come to me because they don't want to lose face, and things go pear-shaped, which has happened a couple of times. So, you know, I'm just learning. I would like to know what I could actually say to them afterwards to say, hey, you know what? Sometimes we all have a bad day, and this is what happens and occurs. Because we go straight to secondary mental health, and we'll go through the GPs to say, hey, it needs to come back to you because we've seen on BPAC what the referral is. So I've got a lot of health coaches who need that guidance. So I've got one new one, but I've had a whole heck of training, which is not as in depth with the neuroscience stuff. Could they be part of a relearning sort of schedule, or is that not allowed? That's my question.
Thank you. So for the new health coaches, that is, you know, what you've referred to as why we have put in weekly mentoring and supervision in place for at least 6 months. Now, the existing ones, unfortunately, at the moment, as we've said, there is no funding for that through to Whatu Ora Health New Zealand, but we are continuing to raise that issue. We have had some PHOs come directly to PREKURE and ask for some upskilling of existing health coaches, or, you know, as something you've referred to there. So it'll just be, you know, trying to work out some funding sources, but it certainly is on to Whatu Ora's, they know about it. So I think if we just keep talking about, we need upskilling of existing health coaches, and we need ongoing mentoring and supervision, and an independent or third party provider. It does mean that health coaches are more likely to come and ask the hard questions, be very vulnerable and real, and get the support they need when they know it's not going to be directly affecting their employment. So I agree.
Kia ora. And Anita, I'm assuming your question's also related to mental health?
Kia ora, can you hear me?
Yes, we can.
Fabulous. Yeah, it is. I just want to circle back to the risk. I'm just wondering sort of what framework are health coaches going to be trained in for suicide? Because it's quite often something that comes up. They'll be handed over for the diabetes, but you know, there's lots going on in life, and that's definitely something that comes up quite early in practice, and the team just needing to know what framework that they're using and what their next steps are pretty early on in the piece. Just a little bit of a local context here as well. Here in Southern, we've got lots of rural practices and very small practices. So often our health coaches are in clinics and they're not in clinics with their health improvement practitioners at the same time. So they don't have that collegial support. So kia ora.
Kia ora. Thank you. Now, I will just check in with Kayla, but we are very aware from with the suicide prevention that making sure that the health coaches that they're trained in the best practice model around that very early on. I'm sorry, I don't know off the top of my head if that is in PK 101. So Kayla, I will just ask you to come off mute and help address that question. But certainly I can say that the health coaches are not only trained in the online on suicide prevention, but then we also actively address it very early on in the live training programs. Kayla, do you have anything to add to that? And in terms of the particular, I don't know if we use a model, but it's certainly the best practice.
Yeah, thanks, Louise. So it will be in PK 104, which is that module that's all around mental health and addictions. And then, as Louise says, very early on in that 2-day intensive workshop about, it's not a specific model we use, where it's more, as we call it, the coach approach. And that really is foundational to everything we do at PREKURE, holding space, addressing the concern for the client, the patient, the whānau, and then putting in place those next best steps to get them through to referral and what that might mean. So that's kind of the approach that we use. We'd be very happy to work with you if there are regional models or approaches that you'd want us to integrate into the training. We're very open to that, to understanding what works best in your region, in your practice. We want to make sure that we're meeting you exactly where you are.
Kia ora. Kia ora, Kayla, that's really helpful. We're happy to reach out with some of our frameworks as well. Just wondering, with you said it was in the module 4, is that the one that would be sort of completed within the first week, or is that still about it down the track a little?
It's down the track a little, and I actually think that's a really interesting point that you've raised. And so Kayla and myself and the team, we will have a look at that and see whether that should actually be brought forward into that first module. It will be touched on in there because it's keeping the health coach and their patients safe, but actually the actual role playing and the more detailed what do you do if you suspect a patient or whānau, has you're worried at all around suicide. So we might immediately have a look at that. So I think do just want to reiterate, we are very, very open to your input and to your feedback. Both Collab and PREKURE, we are passionate about improving the Whatu Ora outcomes of New Zealanders, and we see health coaching as a way to do that. We will respond to your feedback and your input. So please let us know.
Thank you, Louise. That was very helpful.
Beautiful. We are going to, is it another question, Seema, on mental health?
Yes, sorry. Yep. But just wanted to clarify, Louise, you mentioned health coaches would be working with mild to moderate mental health. That's actually the HIP scope. So how, I guess, my first question is it appropriate for health coaches to be working with moderate mental health? Because that can actually be quite complex clinically. And secondly, how are they, how are they taking an integrated kind of model approach to, how's the training accounting for the integrated model approach to working with someone? Because if more of that is going to sit with a health coach, then there is obviously an overlap with a HIP role, and how is that going to be managed in terms of how the health coaches are being trained? And also, just Yeah, it does. I suppose, to be perfectly honest, I have a little bit of concern that health coaches would work with moderate mental health because, in my opinion, that would be more of a clinical role.
I understand, Seema. So to be clear, the health coaches are not, their role is not to work with moderate mental health. Also, we know that in practice, health coaches may and will come across patients who do have mild to moderate mental health. So we will make sure that they are equipped to be referred on to work closely with the HIP role. As we're aware, the funding for the IPMHA health coach training, it does have a heavy emphasis on mental health and addictions and wellbeing. So we just want to make sure that the health coaches do have knowledge and training and skills to support those other roles, such as the HIP. But thank you.
Yeah, and I just want to emphasise that as well, Louise, as a health coach that has worked in practice, absolutely are you going to come across mental health. It's going to turn up on your palette regardless of how diligent and great the booking team is around getting people to the right door. So I do think it's important that we make sure that they have the capability to be able to, like Louise said, refer on when it's out of scope and provide support when they are able to do that. There was a little comment in here which I might get Kayla just to respond to, if you can answer the question by Kirsty around the language around HIP and mental health coach, if that's okay. I don't think we need to bring that to a live question. Anita's asked, would you allow team leaders to complete the online training component so we know the content and can support our teams, or know what we're, I guess, signing our teams up to? You've kind of answered this a little bit earlier, but do you want to just, what would be available for some of our employers to be able to have a look at?
I think that probably sounds like a pretty good idea. Certainly, whether you would have time to go, it's very extensive, the training, and it's very rigorous. But I'm happy to talk about that and get you in there so you feel confident and have a look. It is a lot of time to go through all of that online training, however.
So what we might do to field that is, if you are interested in doing that, just reach out to Renee at the IPMHA at Collab email address, and she'll start to help navigate you into the Collab space to get you access to view that. So just leaning into that area would be good. Kaurangi has asked a question. Will there be guidance or a framework in place for team leads to help keep track and support health coaches in completing all of the required training? It'd be helpful to understand how team leads can monitor and ensure all training requirements of the health coaches are being met, given that the health coach could be at different places in their learning training journey. What a great question, Kaurangi, and probably one that Louise and Kerry will have a few thoughts on.
Yes, we would very much. We think it is to get the best outcome for the health coaches. That's exactly what's going to need to happen. So we will need the support of the team leads, and so that is something that Kerry and Renee both will be making sure that we keep you updated. The moment if there's any issues with attendance or a learner that may be struggling, then we would be reaching out to you as team leads. But we'll set up a very simple reporting structure. It may not have to be weekly, but it certainly would be monthly or fortnightly, where we can say, this is where your learner is, this is how they're going, and if any support's needed. So thank you. We'll look at what we can sort out there.
Beautiful. And again, if you're ever curious or you want an update and you haven't had one, Renee and Kerry will be your contact. So you'll be able to lean in through that IPMHA email address and ask for an update, or through to Kerry as well. So never feel like you can't reach out and ask for updates and support around where you're where your coaches are at. Molly's got a suite of questions. A few of them we've already answered, so I'm just going to go through the ones we haven't. She said our health coaches work as flexi workers, meaning that our health coaches are currently completing their level 4 in mental health and addiction support work. Due to the intensive nature of the PREKURE training, how do you envision the balance of level 4 work, PREKURE work, and seeing patients?
Oh, I don't know, if I'm honest.
It will be so learner dependent, won't it?
Yeah.
Some will smash it and some will probably really struggle with that load.
Yeah. On that note, remember the IPMHA health coach training is going to be a level 4 micro-credential health coach preparation training. That is currently underway with NZQA. So it will take a few months to have that completely put in place. But bear in mind, very shortly, your health coaches will receive a level 4 qualification once they've completed this training. We are also working with the Health Coaches Association of Australia and New Zealand to ensure that the health coaches become professional members of the association, because again, sector feedback was sometimes the health coaches can feel a bit lonely or isolated, and for them to have their own professional body that's supporting them with continuing education and supervision and all those things is important as the profession of health coaching grows.
The next question is, I guess, how do the workshops work if a health coach joins later in the cohort? So say somebody joins the program on the 20th of February, what happens to them?
Okay, so on the 20th of February, you may enroll in the program, you get started. You do your first week where you complete your behaviour as medicine, and then you start attending the weekly live 1-hour health coaching practice sessions where you will have some supervision and support from the PREKURE faculty. You will start attending live your 1-hour lifestyle medicine Ask the Expert sessions where you start to upskill and knowledge around your lifestyle medicine, particularly for primary care. However, you wouldn't do your 2-day intensive training until the next cohort. And at this stage, the next cohort is penciled in for May, but we are flexible to put one on earlier if we get enough people saying, no, we really want to do that. So as I said, we are, we'll really respond to what you need.
She has also asked, with Te Whatu Ora aiming for the health coaches to see between 4 and 6 whai ora each day, what would the expectation be while the health coaches are still doing that initial 6 months of training? That could be a question we take back to Te Whatu Ora and get some clarification for you on. But my expectation is that they would be seeing some patients each day, and 4 seems reasonable to do while you're still learning and training. It might be the bottom end of that.
Yes, yeah, I agree. I think if try and keep your learners to have a minimum of 6 hours a week to come over the 6-month period to do their health coach training. Ideally a little bit more than that, but 6 to 8 hours a week for 6 months. And by the end of that 6 months, they will be highly technically able health coaches who are culturally responsive, who are safe, and who are making a real difference.
Okay, and the last question from Molly, will regional leads connect with service leads and team leads? And absolutely they will. And don't be surprised if a regional lead is a service lead or a team lead or somebody within your team as well. So we are wanting to work within our network to get those roles appointed to. They won't be foreigners outside of the network. We want to make sure we're working with people that are really familiar with the IPMHA training program and delivery. Renee has asked a question around, to make sure health coaches are prepared to support patients when in clinic, how much health coach role play training is in that first week of training? A lot of them are used to role play, aren't they? And the kind of
sure. So remember, in terms of the live training in that first week, if they are employed in a week where there's not the 2-day intensive, they'll only have 1 hour of live role playing, and that's that coaching practice session. That is essentially what that is, and they will be having feedback. However, they will have access to an absolutely extensive health coaching library where they will see just about everything that could happen in a primary care clinic, a health coach delivering in a real session or a role play. Maybe it's sleep issues, maybe it's a little bit of mild anxiety. Whatever it is, there will be a health coaching role play library that they will have access to from week 1 of their training.
Great. This is a great, easy question for the team. Once the health coach has completed the 6 months, can they get the HCANZA registration?
We are just confirming this with ACANZA at the moment. So PREKURE's standard health coach program is fully approved and endorsed by ACANZA. Because obviously the IPMHA health coach training has some differences. There's, how to integrate in primary care and all sorts of things. They need to now just finalise going through it and signing it off. But our expectation is that within the next few weeks, that when they complete the 6-month program, they will be eligible to be a full professional member of the Health Coaches Association of Australia and New Zealand, ACANZA. Yes.
Cool. We're down to the last 3 questions, team. We're doing well. Previously, employers have been able to send support workers on health coach training. Can we still do this? We don't believe that there has been any change to the eligibility of the training program. So if that has been something that's been done in the past, then we can confirm with Te Whatu Ora, and I note that there is a workshop with them on Friday as well, but we wouldn't expect that there's been any eligibility change in the program.
And just on that note, Jess, with the workshop on Friday, I think PREKURE and Collab has an opportunity then to present again. And I've really heard some of those questions about, give us some more detail about the curriculum. Really, how are you going to make sure that from a mental health and addictions point of view that it's safe and those things. So we'll make sure we come to that presentation with some more detail if that's what you would like around that as well.
Another content question, which is how much content is there on motivational interviewing?
Gosh, I don't know how much in terms of hours, but we completely cover the skill of motivational interviewing is one of the core skills of a health coach. So it's covered from an academic, scientific point of view. It's a whole lot of practice is delivered in person. So we just see that as one of the foundational skills of a health coach. So it's extensively covered and assessed.
Beautiful. And the last question was actually a comment. So we are done there, team. We're wrapped up with all the Q&A. This has been recorded. We are going to upload it to the IPMHA website, which has been linked into the Q&A. If you haven't already gone and have a look on there, make sure you do. So you'll be able to jump on, share this recording with others that may have missed it today. We look forward to working with you. Like we said, if you've got any questions on the kaupapa, on our training program, on any of the elements coming through, please reach out to that ipmha@collab.org.nz email address, and Renee will be able to direct you and support you in the right direction. And we really look forward to supporting you as we go through our first cohort starting on the 17th of February. And like Louise said, half of those places are full. So if you have got coaches that need to do some training, please make sure you you hop onto the website, the IPMHA PREKURE website, and you can fill out a register of interest form there, and that will make sure that your name is, or your coachee's name is on the list ready for that cohort. So looking forward to getting that one filled up. We do have maximum numbers and we can't go over those. So once you're in, it's really important that we stick to those. I'm going to close us out with karakia. It's been a pleasure to spend a lot more time than we anticipated with you this afternoon, but I think that's really awesome that you've all dived into the detail of some of the pātai today and into the content of the course as well. And we're really excited to be able to continue to learn and share with you as we grow through this. Closing us out with karakia. Kia tau, kia tātou katoa, te atawhai o te tātou ariki a ihu karaiti, me te aroha o te atua, me te whiwhina tahitanga ki te wairua tapu, ake ake, āmene. Ka aki te koutou.